Good afternoon. Thank you for joining us for this week's Fair Shot Budget Takeover of the DMPED Weekly Check-In. My name is Tomas Talmonte, and I serve as Mayor Bowser's Deputy Chief of Staff, and I will be serving again as your guest host for this week's Fair Shot Budget Takeover. This week, we are joined by Deputy Mayor Wayne Turnage, the Deputy Mayor for Health and Human Services. Thank you so much, Deputy Mayor, for being here. And we'll also be joined with several directors from the DMHHS cluster. But first, I want to thank the Washington Senior Wellness Center, for hosting us today. And some of our amazing seniors that are in the room with us. Thank you all for joining us. A live studio audience, real time. But today, we're going to talk to you a little bit about the key investments in Mayor Bowser's budget in health and human services. And over the course of the pandemic, these agencies, this cluster mobilized to meet the urgency of the moment. They are responsible for bringing testing and vaccination clinics to all 8 wards, as well as ensuring that the most vulnerable people in our society could access essential services during the pandemic. They made sure that all of that was done with an equitable approach to ensure that we had access in all 8 wards. So I just want to thank our Health and Human Services cluster first and foremost for all of their work during the pandemic. And today we're going to have an amazing discussion about a lot of the work that they've been doing and what they want to highlight in Mayor Bowser's budget. And so, Deputy Mayor Turnage, I want to kick it over to you to kick off your cluster, and then we're going to hear from Director Newland from the Department of Aging and Community Living.
Absolutely. Well, let me begin by saying thank you for having me. I often brag that the Health and Human Services cluster is the most important in the city. I certainly brag about the quality of the directors who lead the agencies. And you will get the chance to meet, of course, the director to my immediate right, who will talk to you all about the senior investments that are in the mayor's budget, all designed to help D.C., help residents in D.C., elderly residents age in a age-friendly environment. You'll hear from Laura Zeilinger, who runs our Department of Human Services, and she's going to talk about some of the essential supports and opportunities that she has lobbied for and received support for in the mayor's budget that are designed to help people build the necessary human capital to allow them to better direct their lives and be self-sufficient. Then you'll hear from Dr. Bazaron, who's third from my right, and she runs our Department of Behavioral Health. And there are significant investments in this mayor's budget to deal with some of the growing behavioral health issues that we've seen, some sprouting up during the pandemic. And then I'm sure all of you know to my far right, the unconquerable Dr. Nesbitt. She has been, along with the mayor, the face of our recovery from this dreaded pandemic, and has done an absolutely wonderful job. And she will talk about some of the efforts that she will lead to help bring about racial equity in the field of health as we move forward. So with that, I'll turn it over to Laura.
Director, welcome. I'm very excited to talk to you. And again, we love our DC seniors, and we love the work that Dakal is doing for our DC seniors. But wanted to learn, to every agency at this panel, I can spend hours talking to you all about the amount of work that you did for our residents during the pandemic. And so with Dakal in particular, I want to know what did Dakal learn from the pandemic, and how is your agency incorporating lessons learned in the agency and with the budget investments that Mayor Bowser has made related to Dakal?
Thank you so much for that question. We learned a lot. We learned that we have to adapt as quickly as the world changes. And overnight, it seemed like our world entirely changed. It looks like it's on.
We're having a little bit of a tech issue. Are we good on the mic?
Hello?
Can you give her...
Yeah. A little bit of a mic switch.
Thank you. So overnight, our world changed, and one of the interesting things was that before the public health emergency, we didn't do a lot online. We focused everything on in person. The seniors are nodding their heads. Yep, that's right. We were in person. We were all around the city. And then all of a sudden, we couldn't do that anymore. And so we had to very quickly adjust our in-person programming get people online, get all of our programs online. And so, we had to transform the way that we thought about senior services, and also, I think, transform the way that we thought about seniors. And, all too often, and I say this a lot, I think, when we think about the ageism and the way that people kind of think about aging and don't really want to talk about it, what this past year and a half proved is that seniors are supremely adaptable if we give them the tools. And they have a lot of opinions on what they want. So, it's been really a fantastic thing for us and our team. And I think the most urgent lesson that we learned was that we need each other. We are not meant to live in isolation. And I say that as a global we. It doesn't matter how old you are. And so, in this budget, the mayor has included $2.5 million to create socialization hubs all across the city because we want seniors to have a reason to leave the house, to get excited about what opportunities there are. There's $500,000 to expand our villages, which are really robust, and we want to create that neighborhood volunteer model all across the city. And then there's another $1 million to increase our connector card program, which is a debit card that can be used on any form of transportation. So this is all about flexibility. This is all about, let's create more everywhere for our seniors. And I know they'll come to us. So we're really excited about it.
Those are very important investments, very exciting investments, and I know that our seniors in the room are very excited about those investments as well. And I do want to just thank you, Director, for you and your team during the pandemic as well. The agency stepped up to make sure that seniors that were homebound because of the pandemic were getting meals and having access to important programs such as that. And then also when we started to ramp up vaccinations, Dakal worked very hard with DC Health and with our MOKers to ensure that we got the Senior Buddy program launched to get our seniors vaccinated. So to our seniors, I'm just so excited to be here with you, be all back together because we know vaccination works and it gets us all together. And these socialization hubs are going to be an exciting way to say, welcome back, let's get together. Because we need our seniors. We need to have interactions with our seniors and to be together. So we're so excited about that.
And Washington Senior Wellness Center is one of our vaccination sites in the beginning. And so I know there's a lot of pride at all of our senior sites, but I wanted to give a shout out to Washington Senior Wellness Center for sharing.
We were so thankful. So many of our seniors got vaccinated here through the Senior Vaccine Buddy program. So just a huge thank you to the Wellness Center. Is there any other investments in the budget that you want to call out or bring attention to that excites you?
So there's also an additional $500,000 for virtual programs. So, one of the things that I've heard a lot, and we've been doing all these Zoom meetings now, and I've been dropping into a lot of community conversations with seniors, and I'm asking them, how do you want to reopen, right? The mayor's question is, how can we reopen better and stronger than before? And so in our budget, is $500,000 for virtual programs, because the number one thing that I have heard is, Laura, please don't take away virtual programs. If I want to, I can work out from 9 to 5 every day. I don't have to worry about parking. I don't have to worry about getting from here to there. And so, again, this is really about expanding choice, which I think is really critical for all of us, right? That's how we show we value the community, is by giving people choice and options.
Yep. Very, very important. Deputy Mayor, I don't know if there's anything else in the budget with Dakal that you want to call attention to or that has you excited in this budget.
I won't point to any specific investment. I think Laura hit on all of the key points. I just want to reemphasize the importance that you mentioned of the vaccination program for our seniors. This virus that we were battling was particularly harmful to persons who have underlying conditions or persons who are considered elderly. And so I was just gratified to hear that we've had such a high take-up rate for persons who are elderly, because we want you all to be with us for a long time. And to do that, we need to have the vaccine accepted in the community to ensure that you all will remain healthy.
Well, thank you so much, Director. And I know I'll likely have some more questions for you here a little bit later.
Sure.
But I want to get to Director Zeilinger now. Director, good to see you. I know there's a lot in the DHS budget that you want to highlight, and I want to start out with Stay DC. And if you can talk a little bit about the Stay DC program and some of the investments there, and then how we're just making sure that there's consumer access to services during COVID, how you all made those changes, and how we're making Stay DC and programs like that more accessible to our residents.
Absolutely. So for those who may not know, Stay DC stands for Stronger Together Assisting You. And it's a program that helps us provide rent assistance to people who may be struggling with their rent because of loss of income during the pandemic. So it serves a much broader population. We know that prior to the pandemic, many of our residents were a paycheck away from being able to pay their rent and be at risk of eviction. And with the pandemic, many people have been struggling for a long time with their rent. They owe back rent, and it's because of the eviction moratorium that they're still in their homes. Well, luckily, we have a huge investment from the federal government that allows us to provide rent relief for our residents. We can pay up to 12 months worth of back rent and also help people going forward. And the entire program is available online. So Director Newland talked about so much of the online programming, and DHS has really evolved to provide so many of our benefits and services online and through mobile apps. So residents can apply for rent assistance at Stay DC at stay.dc.gov, and we can support them there with rent assistance. We can pay those rent arrears and also utility assistance that might be owed directly to the utility providers and directly to landlords. Or if a landlord is not responding to the application, we can also provide that support directly to tenants. So we really encourage people, and there's no reason to wait. That money is available now. And it takes some time to do all of the processing because of all the federal requirements around processing those kinds of funds and ensuring that we can have the right financial controls. But the help is there. That we are at a place where, because of the economic impact and economic devastation from COVID, that we could see a massive increase in homelessness in our community, but for this assistance. But it is now up to all of us that people know about it, apply for it, and get the help that they need. So please, if you need help, apply. If you know others who may need it, please make sure to get the word out. People can also, we have our enrollment in our income support programs, not surprisingly, has only increased over the course of the last year plus. So we have more residents enrolled in SNAP, receiving the assistance they need for their families in the TANF program. And we've also been able, through some of the federal relief, to offer what we call pandemic EBT, which it replaces the cost of what the school meals would be. So lunch or breakfast that children might have gotten at school, who weren't at school, we can put that money on an EBT card for families. So we have really increased not only the accessibility, but also the amount of assistance our residents are available for. There are increases in the SNAP program during the pandemic as well. So people can download for Android or for iPhones our mobile app, and they can also go online and do an online application and keep their benefits current with the agency. So it's also similarly an improvement in being able to offer those supports virtually without needing to walk in and stand in line in a service center.
That's very critical and very important. And again, it really struck me when you said it's on all of us to make sure that we share the information on Stay DC. So again, that's stay.dc.gov, and we want to make sure that you share information about that program far and wide. If you are in contact with your MOKers, they are out handing out flyers. Our ambassadors for COVID are handing out flyers to share information about the Stay DC program. But if you know anybody that is in need of help, share that information with them now, because that is how we will make sure that all of our neighbors get this vital, critical support. So again, that's stay.dc.gov. I do want to go into some of the unprecedented investments in single adult homelessness in this budget. Can you talk a little bit more about that and just overall those investments?
Yeah, so there are, as you said, unprecedented $123 million in the mayor's proposed budget across our entire system of care for single adult homelessness. So we've seen through the launch of our Homeward DC plan, and today we actually announced the launch of Homeward DC 2.0.
Very big announcement.
We have a set of strategies that are really about making homelessness rare, brief, and non-recurring. And what that means is we prevent homelessness more frequently whenever possible. When people experience a crisis that causes them on any given day to be without a safe place that is home, that there is the right kind of care for them, there's the right environment for them to come in and access safety, and they're supported to exit homelessness and not return. We've seen in the investments we've made in the last 6 years on family homelessness that family homelessness is way down. We're able to not only replace DC General with small short-term family housing programs throughout our community, but we're able to prevent family homelessness more frequently. We have 90 families in shelter today compared to thousands in the past. And we also have fewer families returning to homelessness. Similarly, we're taking those same lessons to the entire system for single adults. So we've invested in coordinated and streamlined intake to help people more quickly when they touch the homeless services system, in the quality of shelter, and so more people will come off the streets and opt into the shelter program and access to services, as well as the building acquisition and the housing subsidies that people need to exit homelessness more permanently.
Yeah, again, just so unprecedented, and really with the announcement of Homeward 2.0 today, that really sets our trajectory to make that a reality. So thank you so much, Director. I don't know, Deputy Mayor, if you have anything else to add on that portion.
Well, I would just sort of reiterate the points that Laura is making about the investments in single homelessness. I can tell you I was a novice when I took the job as Deputy Mayor about the issue of homelessness. My connection to it was very was limited. And my office now is responsible for managing the encampments, and I can tell you it is one of the most challenging projects that I've ever had to work on. So I am just ecstatic about the new investments to renovate and build new shelters, and the additional dollars that will be going to vouchers to help folks who are living without a permanent residence. If we can mirror on the individual side what we've done on the family side, this will be a remarkable, remarkable accomplishment.
Mm-hmm. And I do want to ask you one more topic, which is the Career Map project. Can you talk a little bit more about that, what it is? Your agency covers so many programs and services, but I'm very excited to hear more about this project.
So I'm so glad you asked about the Tomas, and you see me smiling because it is actually the thing that one of the things I'm most excited about that is new and different. So many of these investments are critical and important, and this is one that I think begins to really change the conversation about economic mobility and capacity and really investing in our residents in meaningful ways. I don't think people who have not received income supports understand that when people who are receiving public benefits and begin to earn, they lose eligibility for those benefits at a greater value than their increase in income. And it causes people to make really untenable choices about continuing to grow their earnings and pursue a career or being able to provide for their family right here and now. And it is one of those things that is built into the systems and structures of our programs that are intended to help people who are living in poverty from being able to actually do the things they want to do for their families, to not be poor and to be able to earn and pursue a career and provide a better life for their children. There is not one family or individual in our programs that I've talked to who says, I just don't want to work because I am doing so well with my public benefits. It is incredible. It is actually the opposite, but we have rules that keep people from being able to do that. So what Career Map does, which I'm so excited about, is it will work with a number of families, about 300 in our initial cohort, who have exited homelessness. So these are families who have experienced the deepest poverty, and we will support them as they pursue careers, and we will ensure that as they earn more, they will have more money in their household budgets, and they will not lose more in benefits than they are making up in income. And we'll be working with our Department of Employment Services, the University of the District of Columbia, our Workforce Investment Council to help them along a career path that will help them have a different economic future. So I think it'll be a demonstration not only for our community but for the nation on how we reform our income support programs to give people a real opportunity.
That is so exciting, and that just it exemplifies why we call this budget the Fair Shot budget.
Yeah.
That is ensuring that these families that are part of this first cohort get their fair shot, get their opportunity, which is just very exciting. So, Director Zlanger, thank you so much for that program, and we're very excited to see it get started. I want to get to Dr. Bowser now. Hi, good to see you, Dr. Bowser. We have seen in the pandemic a lot of not only what we have been impacts due to disproportional health issues in our communities, in particular in the Black and Latino community, but we've seen so much trauma as a result of the pandemic that we're really going to have to be concentrated on as part of our recovery. How are we supporting at every age level the trauma that our residents have experienced as a result of the pandemic? And so I want to know, in particular with our expansion of school-based behavioral health services, what services are we going to be providing for schools, and how do families and children get connected to that?
Thank you for that question. And you are right. During the pandemic, our children, also our teachers and staff, as well as our residents, really suffered trauma, grief, and loss as a result of the pandemic. We are currently in 172 of the 245 DC public and public charter schools. And this year, our goal is to be in every single school.
That's great.
The children within those schools receive a range of services that includes prevention services, as well as early intervention services, treatment services, as well as follow-up services and support. One of the things that we aim to do is, first of all, to make sure that we build resilience among our young people, and that we also support pro-social behaviors. So, for example, assisting young people to deal with conflict or to deal with issues or to support their mental wellness, to get along with others. These are some of the things that we work very closely with our educators on providing. We have we have one mental health professional that is assigned to each of the classrooms within the mayor's school-based behavioral health program. And they are there not only to provide universal primary prevention services, but also to observe what's happening in the classroom and to identify those young people who may need a little bit more. Mm-hmm. And I think that that's extremely important. They will provide both individual, small group, and group therapeutic services to children and their families who are in need of those services. And the services can be delivered either in school or in the community or at home. And so how do you get into the program? You don't have to do anything other than be in one of the schools. And those services are made available to the families. One of the things to note, though, is if a young person is in need of treatment services, it does require the permission of their parent or guardian. And but those services are given. They are free of charge. And we provide a full range of evidence-based practices like trauma-focused cognitive behavioral therapy for those who are really suffering have suffered traumatic events, as well as things like too good for violence or too good for drugs, which are evidence-based practices that are designed to help our young people develop pro-social behaviors. I am extremely, extremely excited about our school-based programs because I believe that we have to bring the services to where young people are. We know that in 50% of the cases, mental health services are identified during those school years. And so we want to be able to reach young people early and often and ameliorate any negative behavior and build resilience and wellness among our youth.
That's very important, very critical, and very excited to hear about the expansion of the programs at the schools. And as we heard from Director Zeilinger and Director Newland, agencies, as a result of the pandemic, we've seen some pivots in different services. And, I think one of the things that we all as residents experienced, I'm sure almost all of us did, was some form of telehealth during the pandemic. And so how are we expanding access for telehealth services, in particular with maintaining behavioral health through telehealth?
Yes, absolutely. We did pivot very, very quickly to a telehealth platform to make sure that people could stay connected to their behavioral health services and supports. In our next budget, we have significant resources that are invested in supporting telehealth. What we found was that the billing for telehealth services among mental health providers during the pandemic went up by 6%. However, we found that the service utilization for those with substance use disorders went down by 20%. Oh, wow. And when we explored that, we found that one of the reasons was because of a lack of access to telehealth, to the equipment, to internet services also. So $2.68 million has been invested in the expansion of telehealth. And what we plan to do with that is we plan to offer telehealth support, including equipment and internet services, to over 4,000 individuals who are receiving services through the Department of Behavioral Health. But in addition to providing them with either a smartphone like this one or a computer, we also are standing up telehealth stations in the community, and we're going to stand up 10 of those so that people can literally walk in to a community site and receive their services via telehealth. We did do a pilot effort of the telehealth stations during the pandemic, and we found that it worked very well. And the results are really astonishing. What we find is that the individuals who are using telehealth really like the convenience. They like the fact that, for example, their wait time for services was much less. When you go into someone's office, you have to sit in the lobby and wait to be called. And so the connection to your provider was much quicker, and that was of benefit. And the other thing is that many people were afraid that COVID was out there in the community, and they didn't want to be around other people, and so they felt safer there. They also, the ease with which they received their service and the ability to access their treatment provider so quickly really made a big difference, and we want to build on that. We believe that telehealth is here to stay. However, I do want to say that telehealth does not replace in-person services. In-person services are extremely important, but telehealth can really augment our process by keeping people connected and maintaining those connections over time.
Definitely. And it's another tool in our health ecosystem. And speaking of health, we're going to get to the doctor. I like to say America's doctor, Dr. Nesbitt. And we just want to first thank you for all of your hard work during the pandemic to get us to where we're at today. Dr. Nesbitt, it's just been just such an honor to work with you during the pandemic and see how you made sure that everything we did was an equitable approach to testing, vaccination, and now as we move to our recovery and health recovery. So thank you. Thank you. And wanted to ask you first, what lessons did you learn? What lessons did we learn during the pandemic about our health ecosystem, and how is this budget going to help us move in a direction that we need to move in for our residents?
Sure. As I was glancing and surveying around the room, I was most excited, like many of you are, to be able to be in person with members of our community again, and that's all due to the fact that people stayed at home when we needed them to stay at home. They got vaccinated when we needed them to get vaccinated. They got tested for COVID when we needed them to get tested. And so as much as kudos may go to me, it also goes to every member of our community who did their part to make sure that we could get through the pandemic and recover in a much better and more equitable way than we were going into the pandemic. The other thing I noticed while surveying this room is this nice thing on the wall here that talks about teamwork. And coming together is just the beginning, but not until we get to the part of working together do we have success. And so much of how we achieved our success during the pandemic was a function of how well we worked with other district agencies. The mayor opened the Emergency Operations Center at the end of February. Everybody here served in some capacity, some more than others, especially at the beginning. And we really also worked with members of other clusters, our partners in economic development and in particular the insurance and securities and banking agencies. So many people had to come together to make us have a great outcome. So that reinforced what we already knew. We knew going into the pandemic that in order to achieve health equity in our community, we had to focus on things that weren't just healthcare related. So these substantial partnerships that we've had that have helped us put the city in a great position in terms of our pandemic response and recovery are the same types of partnership and the same types of energy we need to be successful at ending homelessness, ensuring access to services through a number of modalities for seniors, for addressing the mental and behavioral health of our community, as well as the physical health. So all hands are still on deck, and we're all on board to continue to work together. Right before the pandemic, many of us, led with members of the Office of the City Administrator and Deputy Mayor Turnage's team, were part of a healthcare transformation commission that the mayor convened, where all of the key leaders in healthcare from our hospitals, our health plans, our federally qualified health centers, all came together to talk about how we should improve the healthcare delivery system in the District of Columbia. Even in the last budget, or this current budget that we're in, FY21, despite the economic challenges that many jurisdictions faced, Mayor Bowser continued her commitment to investing in the recommendations of that Healthcare Transformation Commission. And you'll see even more investments related to the Commission's recommendations in this upcoming budget. Those things are critical and essential to our recovery. Investing nearly $4 million in behavioral and maternal health services or perinatal health services, where we're making sure that women who have a high-risk pregnancy are getting the services they need in partnership with 4 organizations, Howard, MedStar, Community of Hope, and Unity. We're also making sure that we coordinate that care in a much better and a much seamless way for folks. But it also begins to help us really think about how we pipeline healthcare providers into our community, how we recruit them, and not only recruit them, but retain them and get them to stay in our health professional shortage areas or our medically underserved areas. As Director Zeilinger has highlighted, we have a long way to go for our economic recovery for some members of our community. Some people had setbacks, some people stayed the same, and some people even became more economically mobile during the pandemic, if you can believe it. But we know that there are things like access to food that is critical for people just to be able to execute their activities of daily living was impacted by the pandemic. When we look at who's begun to use services for food banks and things of that nature, a lot of those people were working but began to lose some other type of income in their household, or had children who were not in school and received their meals at home instead of being in school and receiving their meals. All of those things lead us to need to make a nearly $7 million investment in food access in the district. And this cuts across the continuum. So we're making sure that moms and dads have food to feed the children. We're making sure that our seniors have the food that they need. And we're also making sure that our adult population that's working but still are making choices between medications and food, rent and food, transportation to the job and food, have a secure blanket that they can rely on. It's important when we talk about food access to highlight that we're not just talking about one type of food access. It's great to have all of the healthy corner stores and the farmers markets and all of those things that are trying their best to offer competitively priced foods. But sometimes people just don't have the financial resources to even go to a healthy corner store that's in their neighborhood. Designed to create more access, but if finances are the limiting factor, then you need more help. So as part of that $7 million investment, we're making a nearly $2 million investment in food banks that will help us bridge during this critical time when so many members of our community are relying on that food access. And that will be open to families, to seniors, everyone. We'll continue to make sure we invest in our popular programs that come with prescriptions for getting healthy food, that distributes food to children who attend schools here in Ward 7 and in Ward 8. And we also want to make sure that we continue for those who are homebound or have challenge preparing their own meals, continue to get those medically tailored meals that's so critical to their health and vitality. So there's a lot that we're working to do and respond to the pandemic, and I'd be happy to talk more about it if you're interested.
Yeah, absolutely. I in response to the pandemic, we are very excited to where our rate is at for vaccination in the district, but obviously we want to get it higher, and in particular in Ward 7 and Ward 8. What would you say to residents that are not vaccinated yet? We have all these incentives that we've announced. What's your message?
Get vaccinated. I mean, it's a really short, really short message.
Yeah.
And, we have all of these discussions. Right before I was coming here, President Biden was having a press conference, and he talked about the 5-point strategy the White House will implement over the next several months. And all of those components are very alive and well and active here in the district. What we have to be mindful to do to help us cross the finish line with this pandemic and to prepare for future emergencies is to make sure that we're thinking critically about what that workforce looks like, right? So we're going to make a lot of investments in workforce. And when we say that, people tend to think about more doctors and nurses, but there's over 70 types of licensed health professionals in the District of Columbia. And we, in all of the Health and Human Services cluster, recognize the values of peers and how peer workers help to move people to action. So we'll be making investments in those types of strategies as well. So you can help your neighbor get vaccinated. As Tomas mentioned, we're doing some incentives now, but we're also going to repeat some of the great work we did when we built up the DC Contact Trace Force, hiring over 90% of those folks were DC residents, and many have become permanent employees somewhere in the government.
Great. That's amazing. And then we also have the ambassador program that just started. 178 ambassadors that are out in the community in Ward 7 and 8 knocking on doors daily to get residents vaccinated. So
that's right. And we've kept our eye on the ball. I've talked about our perinatal health investments, but again, going into the pandemic, we were slated to make historical investments in Howard University and improving access to quality services and creating centers of excellence there. We'll be able to nearly double our investment this fiscal year in the mayor's proposed budget over what we were able to do last year. And we continue at DC Health to support the work of the Office of the City Administrator and Deputy Mayor Turnage and his team to bring not just a full-service hospital east of the river, but to make sure that it is a system with implementing urgent care facilities before the new hospital even opens.
That's fantastic. Is there any other budget investments that you didn't get to highlight that you're excited about?
Oh, well, we've got a ton of stuff. I mean, we are taking advantage. How much time do we have? We are taking advantage of all of the financial resources that have been made available during this time, and are going to work our best, continuing to listen to the feedback from our community to advocate for those investments to be sustained over time. Some of the things that we can do to invest in how we communicate information from one agency to another or from an organization to a person, that type of investment can be just one time. But in order to sustain it and improve it, we have to continue making investments. We're going to, through some federal funds that we received, be able to make investments in health literacy, both for people and for organizations. So there's a lot of things that we're really excited about doing in the next 12 to 18 months, and in particular in fiscal year 22.
Thank you, Dr. Nesbitt. I am now excited to say that we're going to take questions from our live audience. I've not been able to say that at one of these before, so very excited for the opportunity. So we're going to go to our first resident question.
Okay. My name is Janice Austin Mason. And first thing that I have to say, I want to thank the entire panel. I want to thank you from the depths of my heart for all that you have done for us and listening to the things that you said. And I am, like Ms. Newland would say, I am a proud member right here, Washington Senior Wellness Center. There's a lot of centers, but this is one of the best, Washington Senior Wellness Center. And I can talk, but I'm not going to go too long. But I'm a product of a D.C. public school. I worked as a proud paraprofessional for 30 years, volunteered for 10 years before I came here. I didn't want to leave. They forced me to leave. But the best thing is when I came here. I didn't know God's blessings was right here. But I advocated for Leckie Elementary School and now for the Washington Senior Wellness Center. But I wanted just to ask you, could they, I know they're having with transportations. I know we used to have Seabury. We had the free transportation. We do have the connector car. Thank the Lord I was able to be a part of that. But I know they're going to get out even more. But with that, I hope that they can expand it to even more of the seniors, because we had wonderful, wonderful trips. We had all kinds of things and things here that they brought to our center. And I want to tell you, I'm a living testimony, because when I came here, I used to be in and out the hospital all the time, but I would go right back to work. But since I came here, I'm going to the exercise class. I take advantage of everything that's given. Everything that's given, I take advantage of it. And it has made a tremendous help to me. I walk with a cane. I don't have any conscience, but you would never know that the way I walk. And it's come from the information, because I take part of the 7 weeks, 6 weeks, 1 day, whatever they bring to us. And Miss Maybeth and her staff, Miss Newland, I always want to say Dr. Newland, her staff, and all the directors we have. We have a wonderful new Tierra Anderson, and we have the members. Our president is here, Charles Turner, and we have my friend right here. She's on our group, and I'm the chaplain, but I was the secretary. But I know I'm gonna give somebody else a chance. But I just want to say we need more. We always advocate to make it a bigger center, and with the food, I know we have the caterer. Thank you for the nutrition. Even though I did Zoom, I wasn't good on the Zoom. I have learned. We have learned. Thank God we have learned. Okay, we're moving right on. Thank you for everything. I have a lot to say, not enough time. Thank you. Amen.
I mean, we may just have to come back and do our own show together next time. Director Newland, I don't know if you, there's a few budget highlights there at the transportation, nutrition.
Sure.
That's very great.
Hi, Miss Mason. It's great seeing you. And thank you for being an ambassador for the power of these wellness centers and the power of getting together and engaging in everything that DC has to offer. So I will say this, because I know there are a lot of concerns about, how are we going to reopen? Will it look like it was before? So I'm going to say some things might not look the same, but my commitment to you has always been that we will do better and we will do more. And I don't think I have ever let you down on that. Okay. So while transportation might look a little different, while our activities might look a little different for a while, they will be there, and we have a commitment to making sure that we are engaging you in the way that you want to be engaged, right? So I've heard you want transportation, you want group trips, I hear you, we got to deliver. So my team is going to work on that with you.
Great. And we have time for just one more question. Unfortunately, we're getting to the end of our program.
Thank you. My name is Charles Turner. I want to welcome each and every one of you to our center. Like they say in other meetings, keep coming back. Talk to the seniors, which lead us into one of my statement questions is that our problems, as Janice referred to, are basically in the center: transportation, food, and overall the fact that we don't have as much input into it. And this probably deals with all of your programs. We don't have as much input as we should have at the front. You know, occasionally we're asked at the end, what do you think about it? Or y'all have anything y'all want to add to it? But a lot of mistakes are made that way. So, and one thing that also goes through all of these things, the transportation, the food, and not having a seat at the table, is the fact that we're dealing with contractors. We've been complaining about the food for at least the last 5 years. We've been complaining about transportation for almost equal period of time. They're still with the same providers. Same people still have the contract. We don't understand why. If you want our input, you've gotten it, but no changes are made. So what can you do to ensure that we get more involvement, more say, more understanding, more knowledge of, and overall ability to put what we say is this equal to what y'all think? You know, how would that?
So you'll be happy to know, Mr. Turner, that we will be recompeting our food contract, and we will have tasting panels, and it will be all seniors from all across the city. So we plan on doing that. We will be reaching out in the next couple of months for a new contract. Now, we can't control who bids, right? But we can control how we evaluate, and seniors are going to be an integral part of that. Transportation, it's going to be bid for 22, and so that's why I was telling Ms. Mason, it might look a little different, but we're still going to have it. And so we're looking at different ways. I know it's been frustrating for some folks who don't like certain providers or certain ways services are being provided. But we do take your input into account. Now, with some of these contracts and grants, you know they're multi-year. So we want to give our providers opportunities to, change and adapt to what you guys are saying. But we are always working on trying to include more senior voices, and you will see us doing that as we reopen, because I don't want you to feel like you're being left out of the conversation. We need you in the conversation in order to fulfill our goal of reopening better than we were before.
I love the sound of the tasting panel. If you need an ex officio member to join you all for that, I can help. I can help with that. Well, thank you all to our panelists. Deputy Mayor Turner, I did want to pass it to you if there's any closing reflections or thoughts before we close out today.
Enough has been said, but I will add, you can see why this sprawling cluster is considered one of the most integral and important for the city, from the services for our seniors to the economic supports for those who live at the economic margins, to folks who are in a downward spiral over behavioral health issues, and to our steady need to ensure that DC has a safe and healthy population. These folks are leading incredible efforts across all of those spectrums, and I am just very thankful, and thanks for having me.
Thank you so much, Deputy Mayor. Thank you again to our panelists. We appreciate you being here with us for this week, our final week of the DMPED Fair Shot Budget Takeover. Thank you to our Washington Senior Wellness Center seniors, the East River Family Strengthening Collaborative. Thank you all as well. And again, I'm Tomas Talamonte. I've been your guest host for this week. I do want to close out by saying, as Dr. Nesbitt said, get vaccinated. So if you're not vaccinated, you can get vaccinated now. We have more information on locations as well as more about the incentives and giveaways at taketheshotdc.com. Again, that is taketheshotdc.com. Thank you so much for being here with us this week.